In this video at Medical Sciences, we're going to dive into ABO blood grouping techniques. We want to see how do we determine blood groups when we get patients in our labs, so that we can know that either they have blood group A or they have blood group B. So we want to see the procedures, and as we begin, we urge you to subscribe if it is your first time and share to many others. So we want to begin with the principle behind blood grouping techniques, because the blood grouping techniques, we have either tile method or tube method, but the most recommended and the most accurate is the tube method. And the principle behind this is that RBCs contain, or they have on their surfaces, antigens. They have antigen A, others possess antigen B. So when these antigens on the surface of red cells are reacted with antiserums, or when they react with their corresponding antibodies, if you have antigen A, when it reacts with antibody A, agglutination occurs. And when you have antigen B reacting with antibody B, still we see visible clumping, or what we can call agglutination. So whenever you're doing blood group and you see clumping of red cells or hemolysis of red cells, it means there is corresponding antigen to antibody. And if you see no agglutination or no visible clumping, it means there is no corresponding antibodies to the antigens on the surface of red cells. So this is the principle behind blood grouping. So the techniques we are going to see in this session is tile, and we're going to see tile method and tube method. And before we begin these methods, we are going to look at different types of blood grouping. We have types of forms of blood grouping, ABO blood grouping. And these types involve cell grouping. We have cell grouping, or you can call it forward. You can call it forward grouping. Then another type, this cell grouping which we are seeing here, we use antiserums, known antiserums, that is anti-A and anti-B, to check for presence of antigens. This one checks for presence of antigens on red cells, on RBCs of the patient. So we are using known antiserums to detect or to type presence of antigens on the cells. That's why we call it cell grouping. And in this type, the cells we use 25 to 30% washed red cells. Washed red cells. These are the percentage of the cells we prepare during cell grouping. That is, this percentage is for the tile method. And if we are going to use tube method, we prepare 2 to 5%. So 2 to 5% is for the tube method, and then for the tile method, we prepare 25 to 30% cells. So this is what we can look at under cell grouping, identifying antigens on red cells using known antiserums, and it can be done by both tile and tube method. And this cell grouping is best, I want you to note, that is NB. This one is most recommended for infants. Infants less than 4 months. Infants less than 4 months, they are not recommended for another type, but only cell grouping. Why? Because they haven't developed antibodies. The antibodies develop after 4 months. So below 4 months, we recommend to do cell grouping on these infants. So another type or form of blood grouping we are going to see is serum. Serum grouping. And under serum grouping, we can call it also reverse. It is known as reverse grouping. Under this reverse, we are using known cells. Here it empowers, we use known cells. For example, A cells, B cells, O cells. And these cells, they are used to identify presence of antibodies in the serum. So these cells, they are the ones that are used to identify presence of antibodies in serum. Hence, the name serum grouping. In cell grouping, we are identifying antigens on the surface of red cells, whereas on the serum, we are identifying antibodies in the serum using known cells, known washed cells. So this is the difference between cell grouping and serum grouping. And this serum grouping is good for individuals, the elderly. For elderly people beyond 60 years, it's better we do serum grouping, and the people who are deficient of gamma globulin deficiency. Because elders, their antibodies become weak as they grow. So it is better to identify them by serum method as compared to cell grouping. So 2 points: note that cell grouping is good for infants below 4 months. Then serum is also good for elders above 60 years of age. But nevertheless, for individuals in between 1 year to 60 years, we can do both. They are all recommended. And we also said tube method is the most accurate method compared to tile method. So that is the things we have to note in this presentation so far. Hope you are following very well. So after looking at the different forms, we are now going to look at technique one by one. And we are going to begin with the tile method. Tile method. Want to see tile method of blood grouping. And under tile methods, you shall need requirements. Requirements, we need 25 to 30% washed cells. These cells are always washed with normal saline or physiological saline. We need tile, clean tile. We shall need tubes. We shall need normal saline for washing. We shall need applicator sticks for mixing. Then we shall also need anti-sealers. Anti-sealers. We shall also need serum. And these are the major requirements we need under tile method. And another point to note here is that it is recommended to do both serum and serum grouping at the same time on the same patient. Why? When we do both cell and serum, we are able to identify discrepancy. So it is always highly advisable as a lab technologist or technician to always do both serum and cell grouping at the same time. So in my presentation under tile method, we are going to do both cell and serum grouping so that we rule out any discrepancy. And another thing, never forget, always include controls. So even among the requirements, we need controls. So after assembling these requirements, we are going to label. We partition the slide and we label. And how do we label? We are going to label, if this is our tile, this is the tile. excuse me, we are going to label as anti-A, then anti-B. We partition for anti-B, and this is going to act for cell grouping. Then we go ahead and we do also serum grouping on the same type, whereby we are going to put A cells, standard cells, we put B cells, we can even put O cells, then we can provide also for the control. Then we shall see the blood, which are determined the blood group from there. So this is my tile which I'm using, and I have partitioned it into different columns. So what we do after labeling, after partitioning the tile, this is the tile, clean tile. After partitioning it, we are going to come and prepare. Of course, we shall prepare. We said in tile we use this percentage, 25 to 30%. So what we do, we obtain the whole blood and we put like 0.5. So we wash, first wash cells. And how do we wash? We get a tube, we put 0.5 mils of the whole blood, and we top up with normal saline up to like 10 mils. Then we centrifuge at 1000 revolutions per minute for 1 minute. Then we decant off the spanator. Then we repeat it 3 times. We repeat it 3 times until we obtain the cells. After obtaining cells, we are going to prepare the percent. You prepare 25% cells. And how do you prepare this? It is prepared by you put 5 drops of washed cells, and you add them to 20 drops. You add 20 drops of normal saline, that is 0.9% normal saline. This one gives you 25% cell suspension. So when we have this 25% cell suspension, what we are going to do, we are going to put during the forward grouping. We said this first partition is for cell, then from here, this is for serum. We are doing both concurrently to see if they will agree. So the first step we are going to do is we are going to put a drop here under cell grouping. We are going to put a drop of anti-serum. We put 1 drop of anti-A and 1 drop of anti-B. That is the first thing we put. Remember, anti-A is always color-coded blue, then anti-B is color-coded yellow. So after putting the drop on each, a drop of anti-serums, then here where it is labeled A cells, B cells, and O cells, we bring 25% prepared standard cells. These ones can be commercially bought, but very expensive, and they have half shelf life, small shelf life. So it is always recommended to prepare them in our labs by washing the way we saw and preparing the standard cells. So these cells we also come and put 1 drop of A cells, 1 drop, 1 drop, 1 drop of O cells, and then we also put the control. The control can be normal saline as a negative control. It can be auto control, auto whereby you're using the cells of the patient, reacting them with their own serum to route auto antibodies present. So those are some of the controls we can use there, and even many more other controls. So everywhere we put one drop, one drop. After putting one drop, we come and add under cell grouping here. We are going to put another equal volume. We add one drop of 25% cells from the patient whom we want to determine the blood group, and even here we put one drop of 25% cells from the patient. Then we mix with an applicator stick gently. It is a gentle mixing. Then to the forward grouping, to the serum or reverse, we're going to also add here on the cells. Here we are using cells to determine the antibodies present in the serum. So here we are going to add one drop equal volume of serum. Serum still one drop, serum one drop, serum one drop from the patient. Each one drop equal volume. Cell grouping is helping us to determine antigens on the surface of red cells. That's why we are using cells and antiserums. These cells are known, so they are going to help us to determine the presence of antibodies in the serum of our patient. That is what we are going to do. So after that, we mix. After pipetting the way we have seen here, the next procedure is mix gently with applicator stick, with an applicator. And make sure you use a stick once on a label. Don't transfer the applicator stick. And always do it gently to prevent lysing of cells. After mixing gently and making like a diameter of 2 centimeters, we lock the tile. If this is the tile we are using for grouping, after partitioning it in different sections and labeling, and we have mixed gently with applicator stick, you hold at both ends and you begin locking. This is what we are calling locking. And we lock for 2 minutes. So during locking, we are trying to mix them. We do it for 2 minutes. And after 2 minutes, that's when you observe for presence of agglutination. You observe for presence of agglutination. Then after you observe on each partition as you record the findings. Maybe we're going to use this place for recording our findings. So we can even use the same table. So if we have here anti-A, then we have anti-B, then we have A cells, B cells, O cells, then control, then blood group. So that was our tile. So after, I'm repeating the tile so that we can record the results. So after locking for 2 minutes, we are observing for the presence of agglutination. So if you find presence of agglutination after adding anti-A, and there is agglutination, and here there is no agglutination, here no agglutination, here there is agglutination, no agglutination, no agglutination, this one becomes blood group A. A, why is it? Because the anti-A reacts with the corresponding antibody, which is A, so there was clumping. And remember, for the B cells, for them to see agglutination, it means on the serum, or it means on the serum of the patient there was antibody B, and antibody B is always found in people with the blood group A. So that's why we are saying this patient of mine, patient number 1, is blood group A. Then we have patient 2. You find here no agglutination. Here there is agglutination. Here there is agglutination, no agglutination, no agglutination, no agglutination. This one becomes blood group B. Why? Because anti-A reacted with antigen B. So the blood group becomes B. And that's why we are seeing A cells reacting. For A cells to react means in the serum there was antibody A. And antibody A is found in the blood group B. Then if we have the third patient, whereby here we see agglutination, agglutination, then we see here agglutination, and here agglutination. Here no agglutination, no agglutination. This one becomes blood group AB, meaning it was having both antibodies and antigens. Then the fourth one is if we find no agglutination, no agglutination, no agglutination, and no agglutination. Then we find with A cells there is agglutination. Then here no agglutination. This one becomes blood group O. But with here there is also agglutination. So if we find this one becomes blood group. Why are there reaction? Because we know people with the blood group O have antibodies A and B. So because there is presence of A and B in the serum under reverse grouping, that's why we see A cells reacting and B cells reacting. That's why we see it there. And on AB, here there is no, because AB groups, they lack antibodies. So here there was no reaction. So since there was no reaction, this one becomes blood group AB. So this is what we can see under the results. Under AB, we are seeing on the forward there is both reactions. But on the reverse, there is no reaction because AB group lack antibodies in the serum. That's why it becomes AB. Then with O blood group, we are seeing reaction on A cells and B cells with no reaction on anti-A and anti-B, because in the serum there is both antibodies A and B. So that's why we get it. So this is the report we can have after our grouping. But as we said, for serum grouping is better under tube than type. And under tube is the same. The only difference when you are doing tube grouping, if you are doing tube grouping technique or method, the same arrangement, we said this one was reverse or serum, then this one was forward or cell. So if we are using tube technique or tube method, the difference is that here we're using a tile and here we are going to do the same thing using tubes. Here we use tubes, but the same way. And another difference is that here we are using 25 to 30% washed cells. Under tube we use 2 to 5% washed cells. That is also another difference, but preferably we prefer preparing 5%. And how do we prepare 5% after washing cells? With normal saline, we get 1 drop of blood, whole blood, of washed cells. Then we add 19 drops of normal saline. This is how we make a 5% cell suspension. 1 drop of washed cells suspended in 19 drops of normal saline. We are able to prepare 5% cell suspension. But here we prepared 25 by getting 5 drops in 20 drops of normal saline. That is also another difference. Then another difference, we shall find that after mixing, when we add antisera with cells, and always remember, always begin with the antisera. Here we begin with antiseras, then here we begin with serum, then we add cells. Always remember that. Always begin with the serum, then add cells. So after mixing, here we intubate. Another difference is that these tubes we shall intubate, whereby we had tubes. After mixing them, we intubate, and this intubation is done at room temperature for 30 minutes, 20 to 30 minutes. Now here we use 5 minutes. We use 5 minutes. After intubating for 5 minutes, that's when we centrifuge. And we centrifuge at 1000 RPM for 1 minute. For 1 minute. And after centrifuging, that's when we come and we resuspend cells. How do we resuspend? By tapping at the bottom. If this is the tube, we tap at the bottom of the tube so that we can observe agglutination behind a white paper in presence of light. So you go in the presence of light in the white background, then you suspend the cell button to look for presence of agglutination. And then you record the results in the same way. We said all the techniques, tile method and tube method, we do both cell grouping and serum grouping concurrently so that we can be accurate. And always remember to include controls. Controls, we can use normal saline, we can use auto control, we can use AB cells, we can use O cells, and so forth. So among the controls we use, I can discuss them here. The controls we use in blood grouping, we can use O cells, we can use normal saline, that is 0.9%. We can use standard known cells against standard known antiserums. These ones we are checking for specificity, affinity, and avidity of manufactured antiserums. Then we can also do both, the way we have seen it, doing both forward, that is cell, and serum grouping concurrently, also to rule out any discrepancy. Then we also have what we call autocontrol. Autocontrol is whereby you get cells from the same patient, react them with the serum of the same patient. Here we are ruling out autoantibodies which may react. So these are the controls we use in blood grouping. All cells, they are always negative because these all cells, they don't have antigen. So there is always no reaction when you use them. It's the same as with normal saline. So here we don't expect, there is no reaction because normal saline has no antigens and all cells also lack antigens. So there is always no reaction. Then if we use standard known cells, A cells, B cells, against their known standard antiserums, we are looking for avidity, affinity, and specificity. When we do both, we are looking for if there is any discrepancy, then auto-control to rule out autoimmunity reactions. So these are the things we can discuss under this session. Thank you so much for continuing to learn with us at Medical Sciences. I told you that the report for tube grouping will be the same for thyroid grouping. These are the only differences. Here we use 25% washed cells. Here we use 5% washed cells. Here we intubate. Here there is no intubation. Here we centrifuge at 1000 RPM for 1 minute. Here we lock for 2 minutes and we observe for agglutination. But in both of them, we wash cells. You can ask yourself, why do we have to first wash cells before grouping? When we wash cells, one of the reasons why we wash cells is to remove any plasma proteins. These plasma proteins may cause false agglutination or false positive results. So we wash cells to remove plasma proteins that may cause false agglutination. We also wash cells. Why? To remove any anticoagulants. Remember, the blood you have collected it in EDTA. Other bloods are collected in CPD, CPDA. So these anticoagulants can cause false agglutination. So we wash to remove these anticoagulants. And so many other plasma proteins which can cause agglutination of cells. Thank you so much. May God bless you.